Okay, guys, welcome to our Turning 65 New to Medicare 6-day mini series. And today it's day one. We're going to start with the parts. Now, just want to make sure you understand this. There are parts and there are plans. So, parts are what we're going to talk about today. Your Part A and your Part B. So, when you get your red, white, and blue Medicare card, it's going to say Part A, which is hospital, and Part B, which is outpatient and doctor services. So we're not going to really talk about Part C and Part D today because those are parts we're going to discuss later on when we talk about how to enroll in a Part D drug plan, and we'll talk about this Part C, which are Advantage plans. Today we're going to talk about Original Medicare Part A and Part B, and just don't confuse those with plans. A lot of times you'll hear about Plan F or Plan G or Plan N. Those are Medicare supplements. They pay after Original Medicare Part A and Part B do. So don't want to confuse you. We're not going to talk about plans. We're not going to talk about Advantage plans. Those are supplemental types of insurance that help out with your Part A and Part B Original Medicare. All right, so let's dive into it. Part A is your hospital. So your Part A covers your room and board at the hospital, semi-private rooms, skilled care, home health care, hospice, and blood transfusions. Now, Part A, basically when you go, if you're admitted into the hospital and you stay overnight, then that is considered, you would be covered under Part A. Just remember, with Part A, it's free. There's no premium as long as you or your spouse work 10 years or 40 quarters. Part A is free. Kind of important. See the skilled care, huge part of Part A and what it covers. Let's talk about skilled care for a second. Say you went to the hospital, you had a stroke or surgery, or you had extensive treatment on your kidney or your heart. Medicare is going to pay for your skilled nursing services if a doctor prescribes certain specialized therapies like physical or occupational therapy. You know, when people get a stroke, they're like, and they can't talk. One half of their body sometimes is paralyzed. They need weeks, if not months, to kind of rehab it. So let me give you 3 examples of skilled care. Physical therapy, after an illness or a surgery or hospitalization, the rehab team will create a personalized plan for you to have a positive outcome. Occupational therapy, that's when, trying to learn how to dress again, trying to learn how to tie your shoes, specialized therapies for memory training and coordinated exercises. And I already talked about the speech therapy as well. So you can't just go to skilled care after you have a stroke. There's rules. And let me talk about those rules for just a second. It says right here, you got to qualify for skilled nursing facility. In order for Medicare to pay for it, you got to be there 3 full days in the hospital. You got to be an inpatient care for 3 full days. And here's the thing: they don't count your day the day of your discharge. So 1 day, 2 day, 3 day, and then they discharge you the next day. That would qualify you for skilled care. So just remember, guys, if they try to kick you out on day 2 and you know you need skilled care, just don't leave. The next thing is Part B. Part B is everything done outside of the hospital, such as doctor's visits, lab tests, diagnostic imaging, preventative care, outpatient surgery. That's a big one. And a lot of times now they do that at outpatient ambulatory surgical centers. Ambulance rides, radiation chemotherapy, extensive dialysis for people that have end-stage renal. So just remember, Part A in the hospital, Part B, everything outside the hospital. Now, a lot of people ask me, they call up and say, hey, do I really need Part B? Well, because they realize Part B isn't free like Part A. Part B, you have to pay $170.10 a month. That's your Part B premium, $170. So people call me up and say, hey, do I really need Part B? What you got to remember is the big thing is, if Medicare is going to be your primary insurance, then you definitely need Part B. You can't afford to pay 20% outpatient surgery or 20% of MRI or 20% of cancer treatments. My apologies, I had to change shirts. I let my Labradoodle the whole upstairs of our house is my office, and I let them up to play around. I spilled coffee all over my shirt, so I've got this shirt now. So sorry if it's jarring to you, but let's move on. But guys, too many times I run into people that are still working. They're 65, 66, 67, as high as 75 years of age, and they've got group insurance that pays their outpatient doctor services. So when they turn 65, they get Part A, and they enroll in Part B. And you got to ask yourself, why are you going to spend $170 a month for Part B when your group insurance through your employer is already paying that? You're just pissing away $170 a month, and it's tragic because I've seen people on low fixed incomes, 69, 70 years old. They're still working for their company, and their group insurance is their primary insurance that's paying. And I said, why did you get Part B? I'm confused as to why you're paying $170 a month and you got coverage through your work. So I've seen so many times agents are giving people the wrong advice just so they can get that Part A and Part B and put them in an Advantage plan or a supplement. Guys, you call me, I'm going to be right up front with you. Hold on to get your Part B. You don't need to spend $170. Okay, guys, I'm going to end on this Part A, Part B. Sometimes it gets tricky. So many procedures that may occur at the hospital, however, end up falling under Part B, such as doctors performing outpatient surgery at a hospital. It's not always easy to determine, whether it's an inpatient or is it outpatient. So if you look down here, outpatient hospital services include diagnostic imaging, CT scans, outpatient surgery done in a hospital, dialysis for kidney, end-stage renal, chemotherapy, MRIs, x-rays billed by the hospital, but that were considered outpatient, lab tests, emergency or observation services, which may include overnight stay in a hospital or services in a outpatient setting, but in a hospital. And let me just go right here and let's take a look. These are some weird situations I want you to be aware of. So let's look at the bottom. The one in the middle is kind of interesting to me. You come to the emergency room with a chest pain. Hospital keeps you there for 2 nights. 1 night is spent in observation, which observation would be under outpatient. And the doctor writes an order for inpatient admission on the 2nd day. So who pays for what? Let's take a look here. So inpatient or outpatient? Outpatient until you are formally admitted as a patient, as an inpatient based on your doctor's order. Inpatient after admission. So who pays for what? Your inpatient hospital stay, all related outpatient services provided during the 3 days before your admission date are going to be paid by Part A. You're still going to have to pay your doctor services, which fall under Part B. Now, let's say you go to a hospital for outpatient surgery, but they keep you overnight. You'd think that'd be overnight would be inpatient, right? So they keep you overnight because you got some high blood pressure. Your doctor doesn't write an order to admit you as an inpatient. He never even writes the order, even though you stayed overnight. You go home the next day. Inpatient or outpatient, the whole thing's outpatient, even though you stayed overnight. And Part A pays for nothing. And your doctor services, your outpatient services, your surgery, lab tests, everything's going to fall under Part B. So if you have any questions, just give us a call, 843-227-6725. And that's the, I tried to give you not just Part A, Part B, but some of the situations that you might run into that might be confusing that hopefully I clarified for you. So tomorrow we're going to look at 2022 costs of Medicare. Huge increase in the Part B premium percentage-wise. We're going to talk about that tomorrow. All right? You guys have a great day. And below this video, is the 2022 May River Medicare checklist, turning 65 checklist. as well as the Turning 65 guide. All right. Feel free to download those. You guys have a great day. Bye-bye.